What I am going to show is a qEEG assessment in neurological patients that it was based on John's Neurometrics. For the first, I want to show that when I was living in Cuba, I worked at the National Research Center, and Dr. John visited us frequently. And in my lab, there were also several students. One of them was Dr. Pedro Valdez Sosa, our distinguished organizer of the GBC. As a result of these visits, we received some gifts, a special computer for the acquisition of average evoked responses, a CAD computer, and this computer has been shown by Professor Michel Valdez, and another equipment designed by the proper Roy, that was the EEG symmetry analyzer. I am going to talk about this symmetry analyzer and the results we obtained. Here is a figure of the lab at Havana, and here is the EEG equipment. It was an Alvar French machine, and we have here the CAD computer, in which we obtain the average evoked responses. However, I will show more on another things that is the symmetry analyzer. When we were in the National Research Center at Cuba, we use this symmetry analyzer, and we have the opportunity to show and publish several things. And first, I will refer to the studies of the EEG symmetry and the neurophysiological basis to do this. The main difference between EEG signals from patients with brain tumors and normal control subjects is the presence of slow wave focus in patients. However, patients with cerebrovascular disease are characterized by a generalized slow waves in their EEG. The main EEG difference between patients with brain tumors and patients with cerebrovascular disease is the topography of the abnormal waves. Here we see an EEG of a patient with brain tumor, and we can see that it is a focus, slow waves present, for example, in the temporal region. This is the characteristic of the EEG of a patient with a brain tumor. However, when we look for a patient with cerebrovascular disease, we may observe that the EEG is characterized by a generalized slow waves. So this is the main difference between the diagnosis of a brain tumor or the diagnosis of a cerebrovascular effect. So using these considerations, we apply this to the symmetry analyzer. And this symmetry analyzer was designed by Professor Rojon, and it's a special purpose device which measures the interhemispheric EEG activation by different groups. We were using this interhemispheric symmetric EEG in which we can introduce two signals as the input, and in case of the symmetry, we are using the homologous EEG derivations, left and right derivations, and the equipment output measure the energy ratio and the polarity correlation coefficient. This polarity correlation coefficient is very similar to a cross correlation coefficient between the two EEG signals. We decide to compare the results of this symmetry analyzer in three groups of subjects: a group of normal adult subjects, a group with adult patients with brain tumors, and adult patients with cerebrovascular disease. This work used the following. The number of patients, normal subjects, were 144. patients with brain tumors were 35, and patients with cerebrovascular disease were 65. We used this interhemispheric symmetry analysis and measured the amplitude, the energy ratio, and the waveform by the cross correlation. So using these variables, we proceed to make a stepwise discriminant analysis between the three groups of subjects. The results of this discriminant analysis, that is stepwise, what it does is to take out the subject that is going to be classified and calculate the discriminant equation with the remaining subjects. And then the result of this equation is applied to the subject that was not included in the measure. And so we can obtain a precise definition for one subject in which group should be allocated. And we proceed with this analysis in the cases of these subjects, and we have the following. We observe that from the normal subjects, 74% were classified as normal. From the normal patients, 90% were classified as tumor, and 70% were classified as cerebrovascular. Here we have the graph. These were the normal subjects. Most of the subjects were classified as normal, a little amount as tumors, and another amount of cerebrovascular lesions. In the group of tumors, in which we have 35 patients, we observe that 23% have been classified as normal, and 40% as tumor, and 37% as cerebrovascular lesions. Here we have the graph. You can see when we use the tumor patients, some were classified as normal, but more of them were classified as brain tumors, and there were also a group that was classified as cerebrovascular patients. But when we go to classify the 65 subjects with cerebrovascular disease, we were able to see that 26% were considered normal. 18% were considered as a group of brain tumors, but 55% were classified as cerebrovascular adequately. So we were able to see that with this symmetry analyzer, we can obtain good results in the classification of the patients. The most important was the classification of normal patients and the classification, of course, of tumor and cerebrovascular patients. Here are the references in which we published these results, and I am great to be part of this homage to Roy. And here we have Roy in a lecture in Cuba at the Ibero-Latin American World Congress of Clinical Neurophysiology. Thank you very much for your attention.